Welcome to this Give Me 15 Minutes education program for medical professionals. My name is Jennifer Searfoss, and I am the CEO of the Searfoss Consulting Group. This presentation is being conducted in collaboration with Searfoss and Associates, a Maryland law firm representing physicians and integrated systems, where I am the principal attorney. This presentation is covering what you need to know about HIPAA privacy and security requirements. This session is available for free through iTunes as a podcast or as a video archive with handouts on jensearfoss.com. One quick legal note: none of the information contained in this presentation should be construed as legal advice. I encourage you to contact counsel if you have questions regarding state or federal law that apply to the concepts covered in this session. With that, let's get started. Today I'm going to cover the history of HIPAA, the difference between security and privacy, and just a brief overview of the requirements in the next 15 minutes. So privacy and security are the two base and foundational concepts that come forward out of HIPAA. The privacy requirements, again, are more of a concept or a culture. The way to think of it, it's more of a philosophy. So any medical professional should know that they're not able to gossip about the things that they see in an exam room or what they see in an operating room. Instead, again, it's the concept of keeping information private. In the same way, within the HIPAA requirements themselves, there's a concept called the minimum necessary requirements. I'll cover that a little bit later. But in minimum necessary, that concept in and of itself, that you only share the minimum necessary requirements for a service to be provided, or in the instance of a health plan to review a service for prior authorization, you don't send them the whole medical record. You just send them what they need. Those in and of itself are private concepts, and that's the general concept or philosophy of keeping information private. Security are locks, keys, doorknobs, the concept that you have passwords, that you should have passwords to change, encryption. All of those different things are physical or technical mechanisms that safeguard information and therefore keep it private. Now, obviously, you can have security measures, but they may or may not always keep information private. So just keep in mind that security and privacy are two separate concepts, but you do need one in the other. So if you're not familiar, the Health Insurance Portability and Accountability Act came forward and is part of the Kassebaum-Kennedy Act way back when. There were two rules that came out of it: the privacy rule and the security rule. They are two separate regulations. And this is where the Department of Health and Human Services came forward with these entities and clarified that covered entities are how HIPAA applies, and that's how they get the hook, the federal hook in. It's actually through interstate commerce. And the reason it's through interstate commerce is through electronic transactions that are being connected through this thing called the Internet. And so who does this apply to? It's for anyone that is transacting medical claims electronically. So it can be a healthcare provider, and solo medical professional. It could be a hospital. It could be an urgent care center. It could be a skilled nursing facility. Obviously, healthcare clearinghouses, which are a middleman sharing this data with health plans. And health plans themselves are covered entities. Any third party that are acting as an agent or contractor of a covered entity and need this protected health information to conduct business on behalf of the covered entity, guess what? They are a business associate, and they need to comply with the same rules and regulations of a covered entity. The MEGA rule did a lot of clarification related to the business associates. The MEGA rule came out in 2013, early 2013, and covers a couple of changes. Actually, it's 4 rules of changes that were from HITECH, which is the Health Information Technology for Economic and Clinical Health Act, which was passed in 2009 as part of the stimulus bill, or the American Recovery and Reinvestment Act. Again, they are 4 rules. The rule is effective March 26th of 2013, and then compliance with the rule is September 23rd, 2013 for new groups. Or for instance, like a brand new business associate, that's when they would need to they would need to comply March 26th, and then existing business associates are September 23rd. So what are the changes? The big changes to spike out for business associates is that if they create, receive, maintain, or transmit protected health information, again, this is broader. It's not just electronic. It is for all protected health information. They are now going to be treated basically in the shoes of a a covered entity. And this is a major change. So for example, e-prescribing vendors, patient portals, data groups that are holding data. So if there's an online Dropbox, if you will, that's holding information, they are all business associates. Now, the rule did clarify that couriers like the United States Postal Service and FedEx, they are not business associates because they are just holding on to the information briefly. The same way Verizon, Comcast, whoever you have that has your internet service, they are not either because they're just transacting business back and forth. They're not actually holding it. But if they actually maintain information or transmit like a clearinghouse, they are a business associate and now stand in the shoes of the covered entity. It's a major change. Definitely work with your business associates. And I do have another podcast that goes over those changes and what covered entities need to know about that. So what's required under HIPAA? Privacy and security. Number one is that you have to have policies and procedures. So you have to write down what you mean and what you're going to do. Secondly is that you need to have officers that oversee privacy and security. It could be one compliance officer. It could be a privacy officer and a security officer. It doesn't really matter. I actually like tandem teams. That way there's more than one person that's involved in these issues. You need to train your staff. You need to look at where there's issues. You need to mitigate them and make sure that there's not continuing problems. And then safeguards to ensure that this isn't going to happen again and, again, stop the bleeding when it's happening. Document, document, document. What are you doing that is showing that you were being compliant? You need to document absolutely everything. Complaints. How do you receive them? How do you respond to them? Who's involved? And then reporting of breaches. So as mentioned previously, minimum necessary is a major component under HIPAA. The concept is that there are instances that you can share information. I'll go over those just briefly. But when you can share information, you don't share everything. So for example, let's say that you have a patient, and this patient needs to go on a step therapy for drugs. They need to figure out which drug needs to work, and that generally step therapy generally requires prior authorization. You're not going to send the entire medical record. Instead, you're going to show what drugs have already been used on this patient, and it might be the last couple months, but it's not going to be their entire life. Now, in certain workers' comp cases, yes, you may be sending them their, the entire incident, but again, it's not going to be the entire patient's life. So, again, think about what you're sending over to them, and again, minimum necessary. And this does, obviously, this minimum necessary concept applies to peer-to-peer treatment information. It goes to disclosures for patient authorization and other things under law. So again, there's certain requirements that disclosures are made, for instance, to law enforcement. So in the instance of a child that you suspect has abuse going on in the home, again, you send the records that are related to the abuse and not necessarily that the child has asthma. Although it could be related, it just depends on how the abuse is presenting itself. So all of those concepts, minimum necessary, do need to be in your policies and procedure. So what is allowed? You are able to, under HIPAA, medical professionals, these covered entities, are able to disclose information for, quote, TPO, which is treatment, payment, and other healthcare operations. So, for example, you can share information with another professional in the course of treatment. So these would be referrals between physicians. This would be instances where you're coordinating care between a hospital and the physician or skilled nursing facility. So coordination of care is permitted. Payment related to payers. So again, this is just when a claim is submitted or the coordination of coverage and claims. Other healthcare operations, for instance, patient engagement. Let's say that you've got an asthma clinic that you're working on and you want to let the patient know about the asthma clinic, then that's another healthcare operation. What you have to get patient authorization on would be something else, like marketing. So let's say that, again, on that asthma clinic, you're working with a pharmaceutical company on giving all patients free albuterol. Well, guess what? That actually may border on marketing depending on how you word that. So let's say that their information would go to the pharmaceutical company and the pharma group would actually directly go to the patients. The patient would need to opt in to that type of communication. So why does this matter? Well, let's say, again, there's unsecured information. So let's say that a laptop gets left on the back seat with the window down in one of the traveling nurse's personal vehicles, and there's information and documents related to 600 patients. That is a reportable instance, and there are fines associated with it. So, and I'll get into, there's some changes on the breach aspect which are really important. So under high tech, the annual calendar year penalty is capped at $1.5 million. Civil penalties range from $100 to $50,000 per violation, and criminal penalties include up to 10 years of jail time and fines. And so again, criminal penalties are for the aspect when electronic or any type of personal health information is used to sell, transfer, or use for commercial advantage. Recent breaches, there are tons of them. I highly recommend that you go ahead and check out the Office of Civil Rights if you're not familiar with them. The first group is smaller than 500 patients where there was a significant settlement. It was of $50,000, and it was 441 patients for the loss of an unencrypted laptop. It was in North Idaho. This settlement was announced on January 2nd, 2013. Again, I highly recommend you check out the list. It's quite amazing, but this all the way goes from lost laptops, things that were left on the subway, lost USB drive. So it's really, again, a really difficult thing for you to look at, but there are certain things that you can do to prevent these disclosures. A breach needs to be reported basically whenever it happens, but there's different ways. So it's immediately reported to the Department of Health and Human Services, the Federal Department of Health and Human Services, media, and of course the individuals affected if it's 500 or more individuals that the information is disclosed. And again, the presumption is, and this is a change in the HIPAA mega rule, so the presumption of risk is that any disclosure is going to be harmful to the patient and therefore is a breach, unless you're, and these are my technical terms, you're really, really sure that the data can't be used because it has super duper encryption. Yes, those are all incredibly technical terms. So unless you are incredibly sure that there's going to be no harm that is caused by the way that the data is stored on whatever was stolen or lost, it is considered a breach. So again, 500 individuals or more, HHS, media, and the individuals. 500 or less, the individuals need to be notified, and then it's an annual report to the Department of Health and Human Services by March 1 for the prior calendar year. So hopefully, if nothing else, I've given you a ton of heartburn and more homework for your medical office or hospital. Other sessions, if you're not familiar with the podcast that I have available through the Give Me 15 Minutes education program, cover meaningful use, cover HR manual contents, what training you should be doing with your staff, HIPAA audits, and how these mobile devices in this BYOD world are affected by the HIPAA requirements. So with that, I hope you enjoyed this presentation. For those of you who are listening to this podcast, please remember to rate this recording in iTunes. To receive notices about upcoming Give Me 15-minute programs, please sign up on Searfoss.com. Thank you for joining me for this 15-minute education program. This concludes the presentation.